Hello, everybody. It's Donna Nauman, nurse practitioner. I'm here today with Dr. Rob Arnone. He is a well-known chiropractor here in St. Louis, and he is here to share some great information with you guys today. So, Dr. Arnone, why don't you tell us a little bit about what you're doing?
Yeah, so thanks, Donna, for having me. Basically, what we're doing is something known as upper cervical specific work, where we're looking for something that's tangible, something that is interfering with the nervous system. It's common to happen at the upper cervical spine where the head and neck come together. There's various reasons for it, and actually in many cases it goes way back to the birth process for the person. Just the way birthing is typically done, there's pulling on the head and neck, twisting to get the wider shoulders to get the child out, and many times that's where the first subluxation occurs, which is where this area gets misaligned, and now instead of just protecting the lower brainstem, which sits in that upper area, it actually starts to squeeze or strangle that area, and many problems start to result from that. And for many people, it's been going on their whole lives. Typically, there's something that puts it further. So there could be certain falls, injuries. We see people fall off a horse. We see people with skiing accidents or car accidents or sports injuries, concussions. There's so many problems that occur that contribute to health problems they're having, but most people would never put that together.
Yeah.
They think it's two separate things.
Yeah.
They would think my neck would have to hurt. Like it would have to hurt right here if that's the problem. But that's usually not how it goes.
Yeah, I don't know. I've seen tons of patients in the office. They'll come in and they'll have like numbness or tingling down their arm. And I'll be, oh, it's your neck. And they'll be like, no, it's not my neck. It's my arm. It's like, well, just because the neck doesn't hurt doesn't mean that it's not coming from your neck. And I think you can see that a lot with migraine headaches. People are taking a lot of migraine medications, and I'm not so sure that we're always really in tune to fixing the thing that's really might be going on. So I know you do some things for people with migraines. Would you speak to that a little bit?
Yeah, so that is something that is really close to me, because when I was growing up, I had a lot of head and neck injuries. We know there were 9 concussions.
Holy cow.
And I had severe headaches where I'd have like blurry vision or nausea associated, or different types of other signs that would show a headache was coming on. But I would have headaches probably every other day, consistently. And nobody was able to figure that out. They would always give me some sort of pills, and it never got the job done. And I really started to get scared as I got older, into my late teens and then early 20s, that no one was going to be able to help me, because I had these problems that were just over and over and over. And so what we do and what we understand is, with migraines, it's a neurovascular component. So it's blood flow up into the base of the skull, into the head, and into the brain itself. Oxygen, which the blood would bring, nerve flow, and even to get deeper than that, cerebrospinal fluid flow and lymphatic flow. That all gets thrown off when this gets misaligned, because this is like the opening, it's like the floodgates to the head and brain, which also allows it to wash out. But yet when that gets into a misaligned position, now it throws that whole system off, and we're throwing off, blood flow, nerve flow, all that, and that will lead to or trigger migraine headaches.
Wow. My mom suffers with migraine headaches, and she also has like a stenosis in her neck. And, she's had every treatment, like the Botox and all of those different kinds of things. And, those headaches just been persisting for her whole life. So I think it's coming from her neck also. Yeah.
Yeah. And unfortunately, what they typically do, and medically anyway, is treat the effects of the problem as opposed to go to the root cause and fix there.
Yeah.
So they look at, what they can see, and then they work on it. So in many cases, like for example, people with migraines, many times have had a head and neck injury at some point in their life, or it could even go back to their birth, but many times there's an injury somewhere. And they'll, if anything, they'll like do like, oh, let's do an MRI of the brain. So they look at the brain and they don't see anything.
Oh.
They go, oh, it's normal. Okay, so we'll just keep you on these meds. So now it's this invisible, mysterious thing that I see many people, Donna, it's really kind of crazy to me, that they get the finger pointed at them like they're mentally, challenged and they're making it up or something. Because the doctor can't see it and doesn't know what's wrong. It can't be the doctor. Oh no, the doctor knows everything.
Yeah.
It's got to be the patient, and you're making this up, and it's ridiculous, So it's just because you can't find the answer doesn't mean you need to point the finger at the person. It should be, let's look further and find the answer.
No, not at all. Coming from a provider standpoint, I feel like when patients come in and we're medicating them for problems, I think initially you're thinking it's something that you can solve with medication. But when that process becomes an over and over issue where it's continuing to need medications over, especially for things like headaches, because there really isn't a lot of good medication for headaches either. So then you got to really start thinking about, well, what else could it be? Because it can be coming from the neck, it can be stress, like it can be tons of other things. And you're right. Like we really need to be thinking outside of like migraine and what a diagnosis of migraine and what medication. Is there something else that we could be doing to help these patients? And so it sounds like to me, like you're kind of digging into this. And I really think that patients need to know that there's hope, like not to just sit and be okay with headaches. Like if it is things aren't working, to seek something different, seek what you're doing and try to get an assessment and find out what's really going on and see if they'll feel better.
Yeah, that would be definitely the smartest thing to do.
Yeah.
Unfortunately, not a lot of people even know I exist or know, what I do or any of that.
Yeah.
And it's a shame, and they're never told anything like that on the medical side. They're just told this is all that can be done. This is all you can do. Take these pills. It's kind of like just accept that, and that that's where that upsets me, because I would love to see. If I saw a patient that didn't have subluxation here, that didn't have pressure on their brainstem. Now I will tell you, it's rare because it's so common. But if they didn't have that, then I just tell them, I'm not your guy. I'm not the one for you. I'm not going to just tell them, well, that's it. Nothing else can be done. You're done. No, it's like, well, maybe there's some other kind of discipline or other kind of doctor that you might want to seek out, because I don't know that you and I are a good fit. And then I move on to the next one.
Right.
Why do other doctors have that problem? Why can't they just say, this isn't going to work for you, or this won't help you? Maybe look at chiropractic, or look at functional medicine, or look at different disciplines, or something else other than outside of what I can offer you. Right. Does that make the doctor look weak or stupid or small? No, I think that actually becomes somebody who's a good, caring doctor, as opposed to just keeping them their whole lives and drugging them the whole lives and putting them under unnecessary procedures and surgeries. And
oh my gosh, yeah, it's something, isn't it? So tell me how your assessment works. Like when a patient comes to see you, I think you do some things that are very different from other chiropractors. Can you speak with that?
Yeah, so everything we do is to know that we know that we know. In other words, first I'm going to sit down with somebody and we're going to talk, and usually it's pretty extensive. Like I hear it probably at least 3 out of 4 times. People will be like, wow, like nobody's asked me all those questions. Nobody's, like we go through their whole life, literally. Like I talk about their birth with them. So it doesn't matter what age they are. They could be a young child, or they could be, 90 years old. We go all the way back to birth, always. And we try to, we don't sit there and go through every detail of their life, but we try to like encompass it all, the main parts. And we talk about, if there was trauma at birth, C-section is a trauma, cord wrapped around the neck, vacuum extraction, those are traumas. Even the normal birth is actually traumatic in many cases, as I mentioned earlier, but then there's typically 1 or 2 or 3, or in some cases 10 different significant injuries, like I kind of mentioned earlier a little bit too, falls and accidents, things like that. So we kind of cover all that, but we also will kind of, briefly cover, just make sure we're not missing anything. So I'll also run over things like how's your sleep, how's your appetite, how's your elimination, digestion. We just kind of run through it all. Vision, anything you're noticing differently there.
Yeah.
Hearing, blah, 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 blah. So we go through it all. Then what we do is we test. We want to know for a match and if there's a problem at the upper cervical spine. That's my bread and butter. That's the best way I am able to help anybody in my office. So that's what we're looking to figure out initially. Ultimately, we're going to look at everything, the whole spine and all that. But really, we want to know, is there a problem up here? So the way we do that, there's 3 main staples that we do at that first visit. So one of them is we're going to look at skin surface temperature. So lower brainstem will control temperature on the skin, and it'll do so in symmetry if it's functioning at ease and the way it should. So I take it, I have like a handheld infrared gun, and I'll look at a spot right behind the ear, right by the atlas, and it's off the skin. So we'll get a temperature. So we'll just hypothetically, we'll say it's 95.0. When we go to the other side here, we want to see 95.0, right?
Mm-hmm. Yeah.
It should be even.
Right.
We give them a leeway of 0.3. So anything off by 0.3 one way or the other, all right, not that big of a deal, but that's kind of the fence. Anything over that is significant. So let's say we're 95.0 and we're 94.0. That's a red flag. That's a full degree off. Why is it a degree off? We let them acclimate for a little while before. They're in the clinic for a little while before. So it's not like, the air conditioner was on and it was on their head and they came in and we take a temperature right away. No, there's none of that. That's going to happen. So why is that happening? So we write that down. We note that. That's going to become a pattern. Okay. So then we will look at range of motion. So now we're looking at things like, if the, say, for example, the top bone of the neck is misaligned, the head sits on that bone. If it's in the wrong position, it's not going to move efficiently and evenly both sides, like turning, for example. So I will measure when they turn to the right, and I will measure them when they turn to the left. And again, now we're at 3 degrees. So if they turn, 40 degrees left and it's 50 degrees right, that's significant, right? 10 degrees off. We note that. So we also look at lateral flexion. So the lefts and the rights are big because that usually shows us the problem is there also. And then we look at posture. So we'll have them lay down, face down, no weight on them. They're just laying down. If you're laying down, shouldn't you be balanced and level, especially when there's no weight on it? But yet we'll see one foot pulls shorter than the other. We will see the pelvis rotate. One hip gets higher than the other. The shoulders, the head. We see it all. We note it all. Okay. At that point, I would know you're a match. You belong here. You've got a problem here. I'm probably 95% sure of that. I'm not at 100% yet, though. We've got to get to 100%. How do we do that? The next step is pictures. Have you recently had any pictures of your spine, especially head and neck area, cervical spine? And that could be in the form of X-ray. That could be in the form of MRI. That could be in the form of a CAT scan, CT. Mm-hmm. So if they had that, I'll gladly examine and see if it shows me enough information about this area, how it's misaligned, so I know exactly how to set it back to the right position. If not, we'll send them out where we have, usually it's X-ray from different angles. We'll do one open mouth, we'll do one from underneath, we'll do one straight on from the side. Wow. We see it from different angles. I analyze it. It's usually 30 minutes or so, analyzing the film, measuring, and then I'm ready for them. It's like I can show you the problem. It's a physical, tangible injury that's causing you trouble that together we can fix. Nice. And that's where things start to get really juicy, really exciting for these people, because they're like, holy cow, like nobody's ever told me this. Like nobody's ever showed me the problem. Nobody's ever shown, and I see it, and I show them in a way, everything I do, and you can probably tell already but just in this short time, is a conversation. I'm not going to sit here and try to use all my training, all my, big words, and I'm going to act like I'm smarter than you so that you can just go, oh, wow, he knows what he's doing. It's none of that. That's baloney. We're going to talk and we're going to have a conversation and we're going to keep it simple so you understand all of it, because that's the way it needs to be.
Yeah.
And either we're going together or we're not. And I'd rather figure that out early if we're not. So we're not wasting too much time or any of that. We're moving on. We put our to the next one. But most people are like, wow, this is great information and I want more. Like, I'm excited. Let's go.
What is that difference in temperature on the neck?
What do you mean by what is the difference?
What's the temperature? Why is the temperature different?
Okay, great question. So the difference in temperature is when the brain stem sits and it's getting strangled because of the upper cervical spine in the wrong position. The bones of the upper neck are round bones, okay? So you basically have three openings. You have a hole in the base of the skull. That's where the brainstem comes through.
All right.
Then you have the atlas, which again is a round ring bone, and the axis is a round ring bone. So they stack. You have the hole of the opening of the base of the skull, the hole of the atlas, and the axis. And now the brainstem goes through. If it sits where these bones are lined up, it's going to control the temperature evenly. It tells the capillaries to constrict or dilate in an even fashion, in a symmetrical fashion, so that the temperature is even, and that's good, and that's what we want. That's function, that's happiness.
So this would be a good test for providers to know too. And you're in the office, it's easy to do the temperature, right? Or is this a specific? Yeah. So like as a provider, I could check both, and I could say, hey, looks like you have something going with the cervical.
Yeah, that you definitely could do that. Sure. Another thing is another easy one. Now there's a few reasons this can happen, but I know one of them, a big main one, is this being out. If you had somebody laying down and you just looked at their heels, at their legs, the feet, are they balanced and level, or is one pulling up shorter than the other? Because that is another way. That right there tells you that this is off. Because what happens
that's when they're laying on their belly.
Yeah, you can do it on their back too.
Yeah.
I do it. That's the protocol we have in the procedure, is face down, prone. But you could do it supine. You could have them laying down on their back, and you can just look at the feet and see, look at the bird's eye view.
Yeah, I really was into looking at leg lengths, especially for knee problems, hip problems. I never thought about the leg lengths being something with the neck though. So I find that's interesting, because a lot of times, like I would tell people, when your leg, one's a lot longer than the other, then when you're walking, you're switching. And so like it's got your spine all off. And I think that causes a lot of other problems in the body too, with different joints and pain and all that kind of stuff.
Oh, there's no question. But it's so interesting, and it's funny because it still gets me today. It's not like I'm bored with it or anything. Like when I see legs are off and then we adjust them up here and then the legs balance, it's so cool. It's like we didn't touch their legs. We're not like pulling on their leg or doing something down at the knee or the pelvis. It's way up here. And it's really kind of simple if you think about it. It's a chain reaction. So this gets in the wrong position, the head starts to tilt. Most people are not going to walk around with their head tilted. You don't see too many people walking around, kind of cockeyed like that. And actually, if you do, it's more severe, and usually they're in a wheelchair. When you see people in wheelchairs, when you look at them, they usually aren't in perfect posture. You usually see some sort of lateral flexion, and then there's other things that will come with that, but that's part of it, because that's just a little more severe subluxation. Those people need the help too. And I'll go up to people in wheelchairs and talk with them sometimes also, and it's always trying to help, right? Yeah. Because who cares about them? They look at them, look at that person over there, and then that's it. It's like, somebody help these people, So there's been times we've helped people. It's been wonderful. But the thing to understand is, so this goes off. Now, if your body can adjust itself, which there are times it can, it usually needs an outside force, but there's times it can use that force and adjust itself. Most times it can't. So this is in the wrong position. So what happens? You have a writing reflex through your eyes to the brain that will try to get the eyes level with the horizon. And in that process of bringing that around and not fixing, now we've just shifted, and now we have one shoulder higher than the other. The pelvis is going to change. It's going to change all the way down to the feet. I like to call, I don't know where I got this from, but this term I choose is that it affects you globally, right? Like your whole body, really.
I'm writing it down, globally.
Not a globe, but it's like your whole body. So when you have it at a position and you've shifted, it also changes the spine itself. That's part of that too.
Yeah.
So many times scoliosis is a direct effect. Abnormal lateral curvature of the spine is a direct effect from subluxation in the upper cervical spine. And I've seen that. I had a kid who was supposed to get a rod put in his spine. Do you know what that does to a person? It's pretty much their life is ruined forever. So here's this kid. At the time, he's like 13, football player, great kid. And he was amazing. Like, if you know anything about football, he would get the MVP as a lineman. You don't see linemen getting MVPs of the league. You see, or the Super Bowl or things like that. Like as a young kid, you see a quarterback, you see the main positions. You don't see a lineman getting it. That's how good he was. But anyway, he was at Children's Hospital here, St. Louis, right? And he would go, and he got to the point where it was like 53 degrees. That's pretty severe, right? And it was rising. They were watching him for like a couple of years prior, where it was getting into the 40s and upper 40s and lower 50s. And they were basically at the point where they just had this hard plastic, I forget the name of the brace. I don't think it's a Boston brace. It might be. But anyway, it's a hard plastic brace that you put around, and it's just very uncomfortable. And it's supposed to like just help the body learn somehow to be straighter, right? They don't work. They don't help. And eventually they want to what? They want to put a metal rod. They want to open them up, put a metal rod, screw it to the vertebrae.
Mm-hmm.
I mean, is that not barbaric? I can't even, it makes me cringe when I think about that. Anyway, that was becoming the plan, right? So somebody at their church told them about me, and they came to see me. Mom brought them in, and I told them pretty quickly, I'm like, do you like wearing that brace? He's like, no, not really. I'm like, well, it's not helping you anyway, so if you want to take it off and get rid of it, you can. And he was so happy. Get rid of it. Well, we found the problem, upper cervical spine, adjusted him, watched him, checked him for a few months. He went back for more visits, with Children's. So for the first time they went, it wasn't getting worse, which was different because it was always worse by a few degrees.
Mm-hmm.
So it was like the same. Then he went back like 6 weeks later or something like that. I don't remember what it was, 8 weeks, whatever. And it started to drop.
Wow.
And then it got into, and it was like, 50, and then it was getting like 40s, mid 40s, high 30s. It was going the other way. And they canceled the surgery. I mean, the kid, I'm down here, St. Charles, by Main Street, old historic St. Charles. And I still remember it, it was like 2 years ago. I'm walking on Main Street. It was like middle of the day. I'll go have lunch or something. I get this phone call from Georgia. Like Atlanta, Georgia, Georgia. I pick it up. I'm just, whatever, say hello. He's like, hey, do you remember me? It was this kid. He moved to Georgia, and he went to Children's Hospital there. They're still monitoring him, and he's fine. And he wanted to thank me. It was really cool phone call. It was so gratifying.
That is super gratifying.
That's a life that his life is forever going to be changed.
That is so
because he got, told to come in, and he did it. And his mom took him in, and they did it. And so taking the appropriate action makes a big difference. And
wow.
Of course, I'm thankful to be able to help him. And it feels great to be able to do that for someone.
It'd be nice to have some referrals from children.
Yeah, that's funny because A lot of my experience, unfortunately, again, it just like goes back to what I said earlier about
Yeah.
if you can't do it, why not
Yeah.
tell them you can't, right?
I
Well,
think
there's
if I,
something, there's some sort of like, I don't know what it is. It's some sort of like ego problem or
yeah,
something.
I
Like, how
think
can
if,
a chiropractor
yeah, I think if
talking
I had
about
a,
almost, it's almost like a witch doctor or something. How
oh,
could this witch doctor
I
help
think,
somebody that us medical professionals aren't able to help? We can't talk about that.
I
So
don't know.
it's
I
just
think if a
horrible, you
patient,
know?
I think if a patient came in and saw me and they had that story, like that's just like, first off, you're not going to do surgery anyway. You're waiting for it to get worse. The intervention that you did was during the waiting period, which all those kids could get in the waiting period and see if this stuff wouldn't be better for them. I mean, you're still going to get your surgery candidates, but trying to do something, and this is why this becomes so like dear to my heart. Like, people ask me, I had a great job, I owned a practice, and the more I learn about medicine, I don't know. Then I start doing this, and I understand because I am a provider. I understand. And to me, this is the stuff that we're missing. This is like, I try to tell patients these things in the office, but they're so focused on this Western medicine thing, which is fine. I mean, gosh, take your medicines, do what you're supposed to do. If you have high blood pressure, take your pills. But if you're wanting to really learn some root cause stuff, begin to think outside the box, begin to look for different kind of providers that are doing things that are helping patients get better. And I know that you are, because like then we're going to talk about concussions next. And I think that there, how many kids have concussions that are left untreated and leave damage for long, long term. And I started going to the functional medicine things and learning all about concussions and what it does to the brain. And then I started learning how to deal with it from a nutritional vitamin. But then you're introducing some really other cool things. So I would love to hear about that too.
Yeah, that is really exciting. And that's near and dear to my heart also because I'm somebody who's had 9 concussions.
So were you
And
a hockey player?
no, actually I did play hockey as I was younger, but that's
Yeah.
not where they came from. So I still play lacrosse and I've played
Right.
lacrosse my whole life. I coach, I play, all my kids play. It's just so much fun. And, you know, 3 out of my 4 kids have had multiple concussions from lacrosse. And luckily, their dad is a specialist. And so we were able to help them like immediately.
Mm.
And, whereas I've seen what can happen if you don't do the right thing right away, it could turn into long term and it could turn into, having to quit the sport and having a miserable life and all these things that can happen if you don't fix the injury. So there's a lot of actually instances, and I want to have my daughter actually my older daughter, my college playing daughter. We're supposed to have her do like a testimonial about it because it was really kind of interesting. She got hit in the head with a ball. Girls don't wear helmets. She got hit in the head with a ball, and she was so out of it that I was like 5-6 feet in front of her, and she gets on the phone with her mom. And she's like, I don't know where dad is. I don't know where dad is. And I'm literally like standing right in front of her. I mean, you could see her eyes just like glazed over, and she was not able to like hold a conversation. It was bad. And we were at Sportport in Maryland Heights, which my office was like 2 or 3 miles away or so. I just took her out of practice. We went right to my office. I had already worked on her before, so I knew what to do with her anyway, but I checked her. We checked temperature, checked brainstem function. That was way off. We checked posture, legs short, same side, all that. So adjusted her and rested her. And as she's resting, I'm talking with her, and she just starts like coming back. I mean, it was just like right in front of your eyes. You could see her just able to conversate, able to have focus again. We literally went to Qdoba, which was around a block from the office, like a half an hour later, and we were laughing about it, eating, burritos. It was really kind of crazy. But I have more instances of that. Like my son just had one. He's a varsity lacrosse player at Wentzville, and I coach. He just had one 2 weeks ago. Probably would have been out for a while because it was pretty bad. He was hit one way, and then another guy had him lined up and hit him in the head the other way. And you could see it. You could see the wrench in the neck, and he went down. He was down on the ground. Was able to help and adjust him, and he's back. He scored 7 goals in a game 3 days after that. I mean, it was like, it's crazy. When you fix the injury, now they're stable in this area. See, the thing they don't understand is they think that a concussion is a brain bruise where the brain hits and rattles inside the head.
Yeah.
That's been the theory forever, as far as I know.
Yeah.
But the problem I have is when they do an MRI of the brain, they don't say, yeah, look at that, there's a concussion. Look at the bruising we see. No, they go, everything looks normal. Oh, just rest, dark lights, no screens, you'll be all right. It's like, no, that's not going to fix it. And even though the person might feel some better and inflammation might subside, and maybe they don't have as bad headaches or whatever the symptoms might have been, then they go, okay, as long as you can kind of run a little bit and it's not exacerbating symptoms, and then the next day we'll get you to practice, and we slowly ramp it up. And within a week, you're on the field again, where you're vulnerable and susceptible to more hits.
This hasn't been corrected, correct?
It hasn't been corrected. So
Right.
They are a ticking time bomb on the field. And many times we hear how they'll get hit lightly, softly, barely, and it brings back the stuff because they've never been fixed. But my whole thing is, I'm scared for these people, because if they get a serious hit again,
Yes, it could
that
be.
could really do it. And they try to call it like second impact system, second impact syndrome is what they call it. And the way they decipher this is, you've had a concussion injury, and then you've had an injury before this one got a chance to heal.
Right.
Right. So it's going to take longer to heal if there's still pressure on your brainstem.
Right.
Than if you have it relieved and removed and corrected, then it's quicker. So I didn't just adjust my son and put him back the next day. We actually took like 3 days, I think it was, of just, we didn't go to practice. I let him just stay home and rest,
Sure.
And then we said, are you okay? We slowly kind of worked him back up.
From a physiology point, I'm just kind of like going over this in my head a little bit. When you have a head injury, if the brain were to swell, and that the brain swells right there, and you're releasing it here, it also allows that swelling to readjust as well. I don't really know. I'm just kind of speculating from a physiology kind of point.
Yeah, exactly, Donna. So what happens is the source is here. Okay. If you start to understand that blood flow comes through here,
yeah,
nerve flow comes through here, the brain cannot function unless it has continual impulses being fed from the brainstem.
Mm-hmm.
It has to, or the brain won't function properly.
Right.
So when you start to understand that, understand here's the true source, and here's the area which makes more sense. Right now, I get it. If you had a fracture to the skull, and that there's been an actual brain injury, that's a little different. But in these concussions, which is what they consider more of a mild traumatic brain injury, doesn't it make sense that there's this big bowling ball, and then there's this little ring trying to hold it up, and the person slammed their head on the ground? That could be slightly off, or is that just
makes
totally
sense
outlandish?
with the head, because the body's going one way and the head is going another. Yeah.
So then when you adjust that, what you're doing in essence is you're allowing homeostasis, you're allowing more balance, you're allowing it to be more at ease, more efficient, the flow in and the flow out.
I like that.
And that's what's needed. And that's what's missed. You can't just sit and rest that out.
I'll tell you, I had a patient who came in with a concussion, and I felt as a provider so helpless, because really they're dizzy, they're lightheaded. Every time they get up and they move, they just can't get it together. And then they're having headaches, and they're there's just, as a provider, is like you said, it's kind of like turn on the lights, but there really isn't a treatment for it. And so, this went on for weeks that he was coming in, eventually we referred him to the neurologist, and, it had to just work its way out, and he was fine. But it would have been nice to have known you then, so that we could have made a referral to get this resolved. Because, weeks went on, and, some people have nausea and vomiting from it. And there's a lot of symptoms that can go along with having a concussion like that. And it's not good for the brain. My mom used to send me articles when the kids were playing soccer about brain injury playing soccer. And it's like, those girls need to quit playing soccer. They should not be playing soccer. I'd be like, so now in this day and age, we have a little more knowledge about it. And I'm glad to know that you could like address those. What is that when happening when you turn your neck and you're hearing popping? Because lots of patients ask me that question.
Yeah, so a lot of times when it gets misaligned, you're going to have less efficient function, like we talked about earlier, where you have, you could measure turning to the right, turning to the left, and that's thrown off because this is not sitting in the right position. Sure. So that is going to affect movement. A lot of times what happens is when it's in the wrong position, it's actually gas that builds up in the joint space. And that's kind of the sounds that you'll hear. Sometimes there'll be actual like arthritis or degeneration or spurs or grinding where it could get down to be bone on bone. But in most cases, it's really not a bone on bone situation that people would think it is. Just like the adjustment itself, when we do the adjustment, which by the way, we don't do that Steven Seagal stuff. We're not going to just like twist your head and neck around, that kind of stuff. It's a very precise, specific adjustment when we do.
Is that the knee chest procedure? Is that what you're doing?
Yes, and that is something that is huge. It's the most difficult adjustment to learn how to master, which is why there's not many. There's maybe 500 in the world who know how to do it. Huh. So it's very, very unique and rare. But once you learn how to do it, it's amazing. Because so what happens is we have the patient turned, their head is already turned, and it's on a solid padded table, and then we're contacting and we're using a vector that is specific from their films, from how the bone has, in this case, misaligned. There's almost 300 different combinations of misalignment just in those top two bones.
Holy
so it's
cow.
not just like, the top one went to the right or second one went to the left. No. It's like a corkscrew misalignment. There's a lot to it. So anyway, once we figure that all out, that's the key to helping them. Once we find it in the film, that's why I love analyzing films, because that's the solution. So then we make the adjustment, set it in the right spot, get them to rest to let it hold, and then we recheck brainstem function. We recheck skin surface temperature. We'll recheck posture, and at times we recheck range of motion as well. And so that's gas releasing out of the joint space. So when we make the adjustment, many times you hear that little clunk or crunch or sound. It's not popping bones or breaking bones or crunching bones. It's actually gas that releases out of that joint space when that happens. But anyway, yeah. So when it's misaligned, and you move around, it's not going to move efficiently. So that's one of the signs. We also have many people who will like pop their own neck, which is really kind of crazy, but they do because they know that something's wrong in there, and for a moment it makes them feel a little better. And that's what you kind of get when you go to like the general chiropractor's office, some kind of just cavitation of the joint, just popping it, just releasing it, and with that might come, it feels looser, it feels freer, so it feels good, but was it really put back in the right spot? Well, you can't really guess that stuff out. I mean, you start to see, I put in a lot of, focus and analyzation and training, and there's a lot of decision making that goes into getting it done right. So you can't just have somebody just kind of, pop their neck one way or the other. And that's what you get when you go to like these places like The Joint or some of these chiropractic offices where they don't take pictures. So they're just like popping it right, or it won't pop right, let's just pop it to the left. Well, you might as well find an 8-year-old to walk up and down your neck and back and give them, $1, and you'll be better off. So
that's something. So it sounds like you're doing a lot of interesting things. I know on your website, I saw things like seizures and fibromyalgia. You have things for that as well?
Oh, yeah. So here's the thing to understand.
You love this stuff.
Oh, my gosh. It's my world. Here's the thing that makes it so exciting to me. And that if people would probably understand this simple part of it, I think it can open things up a lot for them. So here's the thing. It comes down to simplifying everything. to the nervous system. The nervous system is the master system of the body. Every thought you have, every action you do, everything, every function is first in your nervous system. Okay? Now, people would think the brain, and yes, the brain is the computer, and the brain is amazing, and we're basically, brain people. We live through our brains and our heads.
Right.
But the thing is, the source is the brain stem. People have been shot in the brain and lived.
Yeah.
Maybe not doing great, but lived.
Mhm.
People have had the cord severed at different levels, and the spinal cord is very important, of course. But they could live. You're not going to ever meet anybody who was stabbed or shot in the brainstem. It's instant death. And that's because that is our source. So now you take the flip side of that and you take a doctor who focuses on looking at brainstem function in the way that we do to make sure that it's optimal, to make sure that it's at ease, to make sure that it's efficient. Nobody does that. Neurologists don't do that.
Mhm.
They do tests that will check for nervous system and cranial nerves, and
Yeah.
they do have brainstem tests, yes. But they don't look at it for, the top bone in the neck is off by 0.82 millimeters.
Why?
And it's putting pressure,
Yeah.
right? So it's just not done. But
Why
that
would-
is the thing that is contributing to things like a fibromyalgia, or like a vertigo, or like a seizures. Because what's happening is cranial nerves come off of the brainstem. These are the nerves that supply the head and inside, so for like vision and balance and hearing. And so those are now not being fed properly. So should we drug those people? Should we make them move around their head in a figure eight and do different things with their eyes and do exercises and stretches? Well, that's fine. You can also tell them to go to the gym and lift some weights too. Those are all things that could be helpful. But ultimately, if you have pressure on your brainstem, correct that, fix that. It's almost like, and so once in a while we'll do that just for illustration purposes. We'll take a rubber band and wrap it around your finger, right? And now all of a sudden the finger might start to get white, and then it might get red, and it might swell, it might even hurt or throb. It could even get numb. And it's like, okay, should we stretch it? Should we exercise that? Should we rub lotion on it? What should we do there? It's like, well, obviously, you should take the rubber band off. Well, yeah, that's what we're doing here. We're taking off the rubber band. So it doesn't matter the condition. Yeah, we will focus on certain, conditions that we have, like depression is a huge one. Depression, anxiety, those things, they don't need to be drugged. They need to have the rubber band taken off. And so, yeah, we can focus on conditions, but ultimately, you can relate this back to any problem the body has. For example, you mentioned earlier something about blood pressure and people on medication for blood pressure.
Mhm.
Most people don't know, and their doctors don't tell them. And maybe there's no reason for them to tell them, so I'm not completely knocking them on this, but the blood pressure center is located in the brainstem. So, wow, what could that mean? If there's constriction and pressure on brainstem, could that be throwing off blood pressure? Either way, sometimes people have low blood pressure. It's not always high. It's more common for high, but there are people who have low blood pressure.
Yeah.
So what do? Drug them? And that's their answer and they're healthy? No freaking way, man. You find a problem, you fix it. We've had so many people with 2 or 3 blood pressure medications that don't take any blood pressure medication anymore because we found the problem and adjusted them properly, and now they're functioning
Oh,
the way they're supposed to.
interesting. Yeah, I've never heard that either. You've been keeping these things a secret from me.
I'm trying to get it out. I mean, sometimes it's hard to just go, it's overwhelming. This is a chance, this is definitely a platform or a stage here for me to voice.
Yeah.
But in normal everyday life, you're walking around talking to somebody, you're at the deli or something. You're not like, you can't get into this, right?
They don't understand it. Like, I don't know how many times patients come in and I'm going to help them, and I can't help them because they can't fathom the idea that they need to do something outside the box to fix their problem, and I really feel like a lot of disease could be fixed and taken care of differently if people would just seek out different kind of providers to help them be healthier. I mean, and just about, like we could be curing diabetes, we could be curing blood pressure, just changing diet and exercise and doing other, just even recommending it as a start place. And then when those things don't work, then maybe looking at the neck or, like doing just such a different kind of assessment. I'll be using that temperature thing because I think that's so easy. And why would you not do that? Why would you not?
Yeah, so one thing to understand about that is there are things that can throw it off and give you an abnormal reading. And so the common ones, like when I have someone come in for the first visit, I let them know, if you take medication, you want to not have any in your system for a minimum of 4 hours, because that will alter the nervous system function artificially. And many times it'll calm it down and it'll give a false reading of it looks good. Caffeine could do that. Sugar could do that. So caffeine is usually a couple hours. Sugar is like 45 minutes or something like that. Sugar is usually quick. So there are things like that. So that's why I say it's probably easier for someone else like yourself to, if you could just look at their legs, if one leg is shorter than the other, if they took medication, that's not going to change their leg.
Yeah, no, not at
all.
I mean,
or if they drank some, soda on the way in, it's not going to change that. Whereas if you start getting into the world of temperature, that could throw you off.
Yeah, I also think you have to have a good thermometer type thing too. Before we wrap up, because I'm so extremely interested in anxiety and depression and helping people with that, you had mentioned that sometimes when this is not aligned appropriately, that depression can be one of those symptoms. Could you just, just kind of, what does that mean?
Yeah, so it's kind of simple in the way that we're looking at brain chemistry. Again, blood flow, nerve flow into the brain and out. And so obviously there's situations of depression or anxiety where there's, life events. I mean, we're not sitting here telling anybody we're going to take away their past or change all that. Obviously, no. What we can do, though, is we can help them from this point forward to function more efficiently and more at ease so that they're more comfortable inside their head. And they can deal with these things in a more appropriate manner and handle them better going forward. Doesn't become just overwhelming to them, because when you're having a fight inside your head, just because the blood flow is thrown off, you're not getting proper oxygen, and then at that point you're probably taking medication. So there's all these things that are going on. How do you expect a person to function at ease and efficiently and properly and have good decision making and just be a better person going forward? No, it's easy for them to get upset. It's easy for them to, and not only just depression, but the other side of that we see is anger and hostility and things like that. A short fuse. If you ever met someone like that, who you say hello to them and they're ready to bite your head off, it's like those things aren't normal, right? Those things are effects of subluxation, of the compression on brainstem, where the brain is not functioning at ease. So now they try to come up with something with a chemical. They try to give you a pill that tries to help, put it more in balance. But here's the main problem that I have with those drugs. They alter brain function, brain chemistry, and in many cases, that can be really, really bad. It could be, and that's where we see like a lot of school shootings and a lot of these hostilities and suicidal tendencies and murderous tendencies, because you're altering brain chemistry. Whereas what I get to do, which I love so much, is I just get to free it up. I don't control it. I don't speed anything up or slow anything down or say you need more of this or less of that. We free it up and we let the doctor within make all those important decisions, and that can never be wrong for that individual. So that's why I think this is the most custom form of healthcare there is, because again, their innate intelligence, their internal doctor is making all the necessary changes now at that point.
Right.
Yep.
Yeah. So interesting. Yeah. And I would just speak to that. Like, we're not recommending anybody stop using their medication or do anything, just to think outside the box a little bit. And if people feel like they want to be looked at and holistically, is looking outside the box and trying to find other things to help them while they're like, I really feel, again, like I feel like the medications do their thing. But I also think while you're taking it, you could be looking at different kinds of things and avenues and revenues to try to make things better in the attempt to let the body begin to heal itself. So I think a lot of people are missing some of these really critical things that are going on. And that's why I feel so like stuff is important. What you're doing is so important. Helping people is so important. And nobody knows about these things. So hopefully today, everybody, I learned so much from you. Like that was just awesome. In wrap up, is there anything like you really like feel like you didn't get to say that you still would like to speak about?
Well, there's two things on my mind, but I don't know how much time we have or not. But the one to on your point to further that, I don't put anybody on medication, so I don't take anybody off medication. I will give them information a lot of times about what the medication is doing, and it's as simple as I have an app on my phone that I can, literally show them like adverse reactions, things like that. So they see that. And then we just help them in a different way. And many times they decide that they want to start weaning off, or they figure out how to do that. I don't really get into all that with them.
Yeah.
So I just offer what I offer to help them. I show them how, and we help them. And many times they end up, doing it themselves. But the other one I wanted to mention is you talked about like if there was a case or two. Mm-hmm. So there's one case, I think he's definitely a walking miracle. There's a lot of people, we have a lot of great things that happen in the office, but this one, and he was in yesterday, he comes in every week. So I did a diabetes talk at my office. This is pre-COVID, and this was when I would have people come in. So we had 10, 15 people, and he was there. And so he had diabetes for a number of years that was contributing to blindness. So his wife was with him, and he his hand had to be held, and he had to be told like where the chair was and where this, that. So he couldn't see me when I did the talk, but he could hear me. He ended up becoming a patient, and he was taking, I believe, 2 to 3 insulin shots a day, amongst a bunch of other medications. Kidney stones, he was too heavy to do surgery on, so they wanted to lose weight before they could do the surgery on these kidney stones, and the blindness, as I talked about. So we started him under care, and probably within about 6 months, maybe a little bit less, he started to see. So what happened is he's got 10% vision in the right eye, and it's mostly peripheral. So this eye can't see anything up in here. Left eye, he has about, I think it was like 60% vision. So that was the good eye, is the left eye. So anyway, after a few months of care, this eye, the field of view is starting to grow. So it's opening up. So now he's more like about 40% in the right eye, and he's getting up to like 70% in the left eye. And he's seeing more light. And some days are better than others. I mean, it's not a perfect fix here or anything, but it's just so exciting to see this transformation. This gentleman he walks now. He doesn't have to have his wife hold his hand. He knows where the chair is. He knows where the hole is, the door is. In the car on the way over, he used to just sit in the car and like have his head down because, I mean, it's like you can't see anything anyway. Well, now he looks out the window and he looks at, oh, there's a business over there. There's this place and that place. So wild. So we kind of talk about one day how he's going to drive himself, to the office. Great guy. But again, he's a walking miracle. I mean, not only that, he had these kidney stones. We talked one day. I'm like, is there anything else that in the meanwhile we can, we're missing or we can work on? And he talked about these kidney stones, and his wife mentioned it also. So I just started working in the mid-back in the area that supplies the kidneys. I think it's like T9, T10, something like that, where the nerves come out of the spine to go to the kidneys. So I started working on that too, like when he didn't need an adjustment, because there's many times he comes in, he gets checked and he's holding, so we don't adjust him. So I would do a correction in the mid-back. He went back for an ultrasound like 2 months after I was working on his mid-back. And wouldn't you know, the stones are gone. I don't even know what happened to him. All I know is he said they kept turning off the machine and turning it on, unplugging it, replugging it in, because they've been watching him for years,
Mhm.
and they just couldn't fathom how they would be gone. I
Isn't
mean,
that
it's
interesting?
crazy.
Had he ever been in an accident or had any kind of injury that led to the, yeah, to lead
So
to?
he did have, I forget what his was. Yeah, I can't remember it right now. I need his file, and I feel bad about that. But he did have. There was multiple. There was like, I think there was like a fall. I think there was a car accident in there. You know, and that's common. Is these things happen, and then but nobody puts that together, right? Like even with myself, with all the concussion injuries I had, and then all the health problems I had. You know, heart palpitations, breathing problems, blurred vision, motion sickness, headaches. You know, on and on. I never had any clue that that was connected to the head and neck injuries I had until I started getting this fixed, and all those things went away. I mean, I'm talking now, you know, 26 years and counting, completely recovered. I don't have any of the problems that I had for the first 24 years of life, you know.
So
And it's like, it's just so wild. It's a better way to live when this is just flowing. There's nothing like it, you know. I mean, so that's the message I would want people to understand. No matter what problem you have, we can always check for this, right? Because that's what I'm going to do anyway. I'm not going to tell you that I have the cure for, you know, seizures or multiple sclerosis or, you know, fill in the blank, migraines, neck pain, headaches, whatever. It doesn't matter. If there's a problem here, it's related because it runs the body. If there's not a problem here, then I can't help you. So I always recommend come in, get checked, and start to learn if this is causing problems unnecessarily. You know, your life could change like that. I mean, I see it happen, and it's wild. So, I'm a living proof of that myself. I mean, my life, I've been blessed to learn about this and have this done to myself personally, as well as now to offer it for others. So I'm definitely very thankful for that, and I appreciate you for, you know, reaching out to me to say let's talk about this, let's get it out there, because I definitely, you know, would like this to be known more. I think people need to know and at least have the option. Whether they aren't interested or they don't want to try it, that's fine. But at least they should know this exists and know this is an option.
Yeah, I think it's just a process of like somebody will watch this, and hopefully like my call to everybody is if you see something and you like it and you know somebody that needs it, like pass it on. Our job here, like you and I can only do so much. Like we can sit and talk, we're talking to no one. But once the video is picked up, if people bring it to somebody else and they share it with somebody else because they've heard things that they think are interesting, then I think that that's how we begin to heal the world. Just one video at a time. Is it going to reach everybody? No. But if everybody does their part and everybody like just handles this with care and allows people to become more open to what's going on, then we have an opportunity to help more people and get people well. So.
And that's what it's all about, sister.
It is. Well, thank you so much. How do people find you?
Well, I guess MidwestUpperCervical.com is the website. It's just those three words combined: Midwest, Upper, and Cervical. I tend to be on Facebook a lot, but you know, I don't know how much longer I'll do that. But I'm on Facebook now. It seems to be my way of meeting and talking with a lot of people.
Yeah.
People can message me there. I think it's just Dr. Robert Arnone. Maybe St. Charles might be after my name. And then I'm just also on my personal one, it's just Rob Arnone on Facebook. I think I have an Instagram still. I don't think I'm on Twitter anymore. So, you know, and then they can call me. I don't know if there's something we can attach to this where there's, you know, like kind of a comment where we can put
I'll put something
contact information.
Mm-hmm.
But obviously, and you know how to get a hold of me, so it had to be, if they had to get a hold of you to get to me, then that's fine too.
Yeah.
Whichever way. But I just think it's very smart to at least get checked. And then, you know, with what we're doing, it just seems to work. And so I'm just happy to do it. I really am. I'm just happy to do it, and I'm happy to share about it. I could probably talk for about 3 more hours, but obviously we don't want to, you know, exhaust people today. But yeah, any questions you have about your health, or if this is a possibility or not. You know, and we see a lot of people from other states come in, and many times what I do is I'll have them send me pictures ahead of time so I can already analyze and see if it looks like there's misalignment there, which helps to warrant them taking off work, taking a trip to come here, hotel, all that.
Yeah.
It makes it more worth it for them that way. So we do
That's
that as
awesome.
well. And there's a few in the country that I trust and that I connect with that I could always send you somewhere else. So this isn't just about me as much as it's about the work.
Right.
Yes, I'm responsible for what I do, and I like to think I do very good work and I can help you. But hey, if you're in a certain part of the country where we might have an affiliate or somebody that's good, then we're happy to send you there. That's fine too. So.
Well, thank you so much. Thank you so much. And it was so informative. Your heart is so into it. And I think everybody that's watching this will see that that is true. So thanks again for coming and showing up with me here today.
Well, yeah, I'd love to be here. So thank you. Anytime. I'd love to see you, Donna. You're awesome. So
Oh,
thank you very
thank you.
much.
All right. See you later.